Hello, everyone. My name is Carol Matter. I am one of the coding educators here at Emory Healthcare, one of a team of 9 people who are coding educators. And today I'm going to be talking to you about annual wellness visits for Medicare patients. And they are visits that can be rendered to Medicare patients or patients on Medicare Advantage programs. The Advantage programs also have to honor the wellness visits just like Medicare. And this first slide shows a range of the codes that are similar to the wellness visits that we're talking about. There are also physicals that are not covered by Medicare, where wellness visits are 100% covered by Medicare. And in the occasion that you have an E&M visit that is rendered the same day, that is also billable on the same day as a wellness visit. If there is an E&M, though, that you need to put a 25 modifier on that charge code, and Emory would require that you have 2 separate notes, one for the E&M visit and one for the wellness visit. And part of the reason for that is that any of the elements of the wellness visit cannot be counted towards the E&M visit when you're determining what level of visit you have provided. And that can be for a new patient or an established patient. Going back to the physicals that you see on the screen, the 99381s to 99397s, those, of course, are coded by the age of the patient, and Medicare does not cover those. Medicare Regular Part B does not cover those. The patient is 100% responsible for the bill, and they are very different than wellness visits. Do keep in mind, though, that there are Medicare Advantage programs that some of them will cover a physical. So that is something that the staff would need to make sure what the patient's coverage is. All right. First of all, there are 3 types of Medicare wellness visits, and the first one is called the IPPE, or the Initial Preventive Physical Exam, is what the IPPE stands for, and it's also known as the Welcome to Medicare exam, and the reason for that is it must be performed in the first 12 months that the patient is eligible for Part B Medicare. If the wellness visit is performed after the first 12 months the patient is on the Medicare Part B, then it becomes another type of annual wellness visit called an initial wellness exam. And this IPPE exam has some extra requirements that I want to point out to you. Frequently, some of the elements of this IPPE are missed, and one particular thing that is often missing is the visual acuity screening, and you'll see that highlighted there in yellow on this slide. And that would mean that you need to do something like a Snellen chart or the Big E chart exam with the patient, and the results of that need to be recorded. It also requires that you do a BMI and the patient's height and weight and blood pressure. And if you are unable to get the patient's weight and height, then you can do a waist circumference instead of calculating what the BMI would be. This IPPE is also your unique opportunity to schedule for the patient a screening EKG, meaning that you don't have to have a diagnosis that would cover the EKG. And it's also an opportunity for you to plan, if appropriate, a screening ultrasound for an abdominal aortic aneurysm, or the AAA screening. And in the cases where we do these a screening EKG or a screening AAA ultrasound, there are special codes that need to be used for those rather than the regular CPT codes for those tests. In other words, rather than using a 93000 or 93010 for an EKG, you're going to use a G0403 or a G0404, depending on whether you did the interpretation or not. And you will see that here on this slide. And the code, if you're doing a screening ultrasound, is G0389 rather than the regular CPT code. Also, we want to, as we conclude the patient's visit for this Welcome to Medicare exam, we want to plan for them their future screening tests that might be appropriate for that individual patient. You need to give them an individualized screening schedule as part of this, part of the documentation for this type of visit. A brief written checklist could be provided to the patient, and then in concluding the visit, you would suggest to them that they have their next wellness visit at least 1 year from today's date. Okay, and now, like I mentioned, that there is another type of initial annual wellness visit, and this one is billed as a G0438. Going back to the IPPE, that one is a G0402. Okay, and this annual wellness visit, this initial one, G0438, must always be performed before you ever bill a subsequent annual wellness visit. So whether or not you ever captured that first IPPE that falls in the first 12 months that they're on Medicare, whether or not you captured that because of the time frame required, the next one that you bill is always a G0438. And say the first annual wellness visit that the patient ever has is a couple years after they got on Medicare, then it's automatically going to be this one, this G0438. And then every year thereafter, you can bill a subsequent, or you can perform and then bill a subsequent annual wellness visit, which is a G0439. And in this annual wellness, this initial annual wellness visit, you're going to make sure that you have their medical history well documented and all of the risk factors that pertain to that patient. You also, in all of these wellness visits, need to be sure include their family history. And later on, when we get to the subsequent AWVs, we're going to just be able to update the history, anything that has changed in the interim between the year of the visits. But in this initial one, you want to well document their family history. Also want to mention that I sometimes see that the history is unknown, and that is something that if that is the situation, we need to document why it is unknown. It might be that the patient is adopted, or they are estranged from their family, or their family is in another country and they have no contact with them, or it might be dementia, that they don't remember their family history, medical history anymore. But if there is some reason that is not able to be documented, you need to put a reason for that. And in this annual wellness, this initial AWV, we also want to, again, have the patient's height, weight, blood pressure, their BMI, and if you can't calculate a BMI for some reason, then you do a waist circumference, and you need to have the visual acuity screening in this initial one if you didn't do it in the IPPE. If the IPPE wasn't performed, then this is your time when you would do the Snellen chart test and put the results. You're going to, again, list their risk factors. That would be their maybe chronic medical problems. and say, if they're a smoker, that would be a risk factor. And anything that you find are risk factors for the patient, you want to document in what way those issues are being handled, what kind of treatments are being rendered. And you would also list the chronic or the medicines that the patient takes, and you also list the other providers that are involved in that patient's care. And I sometimes see that just that the patient goes to, say, a cardiologist, but we would like to know who that cardiologist is, because if you have a need to make an urgent referral for that patient to their cardiologist, it would be helpful from this documentation to know who the cardiologist is in their care. Also, the name of the pharmacy where they typically get their medicines filled. Another thing that is important to all of the annual wellness visits is that you list the patient's functional ability and their safety. That has to do with, is the patient able to handle their own finances, or their grocery shopping, or they're preparing their own meals. And you want to document those activities of daily living and also the safety factors around their home environment. For instance, do they have grab bars in their bathtub or shower stall, and do they have throw rugs around their apartment or home that are a risk for them tripping and falling over them? Those kind of things are part of their functional ability and their safety issues. Once again, in this initial AWV, we want documented what their future screening schedule should be, and it can go out, say, 5 to 10 years, but whatever is appropriate for the individual patient. For instance, they might have had their last colonoscopy when they were 60, and the doctor said that their next one should be 10 years out, and so you would put that their next colonoscopy is due, in a certain year, say 5 years from now. And you want to give them education on anything that seems appropriate for that patient, and give them their personalized prevention plan. Okay, and now on to the annual wellness visits that are the subsequent ones. You can do one of these every year. They need to be at least 12 months apart, so we don't run into doing one too soon. But these are billable each year after the initial one. The GO438 has been billed, then every one after that is a GO439. And these are mostly an update to anything that has changed in their history, their risk factors as they age. And on this one, you don't need to document all of the vitals that you needed in the initial or the IPPE. This one, you just need to document their weight and their blood pressure. Doesn't hurt to do more at any time, of course, but the requirements are just for the weight and the blood pressure. But like in the earlier annual wellness visits, you again need to assess their cognitive function, because that is something that does change over the years with most people. So you need to document the status of their cognitive, and also update their screening schedule. List the risk factors. They could be the same, but if anything has changed particularly, you're going to document that and furnish them with their health advice and make any other referrals that are needed at this time for the patient, and update their prevention plan. Okay, so there is essentially a 5-step process when you're going to do an annual wellness visit for a patient. You're to you have the patient complete a health risk assessment form. It's a set of forms that are kind of standardized. Most of the practices have these, and they give them to the patient to fill out, and that when the patient completes them, it covers about 6 of the elements that are required in the annual wellness visit. So something that is important to have done and then scanned into the EMR system so that we can see that it is there. And should the record be requested by Medicare or a Medicare Advantage payer, we have that information available to show the proper documentation of the annual wellness visit. When the patient has filled out this health risk assessment form, or we'll call it an HRA, you want to make sure that they have completed the different items. I sometimes see that they have, not filled out anything for who their other providers are, or maybe their family history, they've just left it blank. If that's the case, you need to fill in that documentation in your notes to make sure that we've covered all the elements that are required. After you have made sure that HRA form is scanned into the EMR system, you're going to go ahead and select from the EMR the proper template to fill out the visit. You're going to create and you're going to educate the patient on their personalized prevention plan and document that, and then you will determine which of the 3 types of annual wellness visits this one is, and assign the proper G code for the charge. Remember, the G0402 is the one that's in the first 12 months. That's the Welcome to Medicare exam. The next one is the initial. You always have to have the initial one on every patient, and that's a G0438. And then all subsequent years, it's a G0439. Okay, and this is a slide that shows the templates that are available in the system. And you would click on that so that you can pull up the proper format to complete this visit in your notes. Okay, some common questions that we encounter about these annual wellness visits. First, like I said at the very beginning, you can bill an E&M visit on the same day as an annual wellness visit, but no components that are part of the annual wellness visit can be used to calculate what level of E&M service you have provided. And that is why it is also helpful when you do a separate note in the EMR system. And when you have both of these occurring on the same day, a 25 modifier must be added onto the E&M code, but it is not added on the AWV. Also, sometimes we're noticing that the documentation that you have performed for the patient is really a true physical in the 99387 or 97 codes for Medicare age patients. And we're seeing them converted sometimes automatically to G codes by billing staff, and that is not the proper thing to do. It needs to, if it is truly a physical, then it needs to be billed as the appropriate CPT code and not converted to a G code, because the requirements are very different. And in the case of the physical, it could be that the patient is responsible, and if that's the case, they need to be made aware of that in advance, and an ABN or waiver form showing their acknowledgement that they are financially responsible for that physical. That form needs to be signed by the patient in advance and scanned into the EMR system, and then a GA modifier is put on to that physical, indicating to the payer, to Medicare, that the patient has been informed that they are responsible for the bill. Okay, and if you have any questions about the annual wellness visits, I have been working on these for the last year and a half, and so I would be happy to answer your questions. I have my contact information on the screen for you. I'm available at 404-778-4830, and my email at Emory is carol.matter@emoryhealthcare.org. And there are also additional resources that you might want to take a look at through the Medicare Learning Network And on this slide, it shows the website to look at that information. It is very detailed and provides a good list of the requirements of each of the types of annual wellness visits.